Hello everyone, my name is Hussam Al-Zubi. I'm a vascular medicine fellow at Mayo Clinic. And I have with me Dr. Muhammad Al-Khouli. He's the professor of cardiovascular medicine at Mayo Clinic as well. Welcome, Dr. Muhammad Al-Khouli. Okay. We can start with opening question. Can you tell us more about the study?
Yeah, thank you, Hussam. It's a pleasure to be with you here today. So our study tried to answer a common question that we face in clinical practice is, do residual leaks after percutaneous left atrial appendage closure have any clinical implications? And to answer that question, we leveraged a very large data set from the ACC and CDR registry. It's called the LAO registry. We looked at over 50,000 patients that were treated with this technology up to 2019. And the primary endpoint was to see if those patients who have leaks have higher incidence of cardioembolic events, thromboembolic events at 1 year after the procedure. So we stratified the cohort into 3 groups. One group had no residual leak, another group had leaks less than 5 millimeters, and the third group had leaks more than 5 millimeters. And you may ask, why did we select the 5? Because that's the arbitrary cutoff that is used currently in practice, that if patients have leaks more than 5, then it's considered incomplete. Those were less than 1%, but almost 25% of patients had leaks that are in between, more than 0, but less than 5. And those actually ended up having higher events, higher adverse event. So there was a 15% increase in thromboembolic event in patients who have small leaks between 0 and 5, or above 0 and 5 or less. And the same group had 10% more bleeding events, and that translated into about 15% higher major adverse event altogether.
Well, thank you. How about the patient population, or was there any specific patient population you guys selected in this study, and what kind of methodology did you use?
Yeah, so just I started off by saying this is the left atrial appendage closure population, which is a small selected group of patients with atrial fibrillation. As you know, there are several million patients with atrial fibrillation in the US. A lot of them are recommended to be on oral anticoagulation, but some cannot because of frailty, bleeding, other issues. So those selected group of patients, they are increasingly undergoing percutaneous closure of their left atrial appendage, which is deemed to be the source of most embolic events in them. And that's the selected group we studied, the patients who already underwent left atrial appendage closure.
Thank you. And what do you think is the results of this data and this study will change the practice going forward?
Yes, great question. I think the important implication is, as of today, most of us would look at leaks that are less than 5 millimeters are potentially insignificant. So this study told us that actually any leak is significant, and we need to try to mitigate any residual leak after the procedure. Fortunately, now we have ways to do that. We have newer devices that are known to be associated with less incomplete closure. The study was done with the first generation devices. And we also have some planning tools that allow us to get more coaxial deployment of the closure devices and have better closure.
Well, thank you. And do you have any future suggestions for medical student, resident, and fellow, any future projects that you recommend for everyone else to start working in?
So you know, this registry is initiated and maintained by ACC, and it's available for researchers who are fellows or young faculty to query. The LAO registry started in 2016, and there is a routine research and publication process that you guys can get involved in. Same thing happened with Cath PCI registry, TVT registry. So I would encourage fellows to utilize that tool. It's accessible to ACC fellows and members to use for clinical research. So if you have any relevant question in your practice, you could submit a proposal and hopefully answer that important question.
Thank you, Dr. Al-Khouli. That was very valuable information and a concise summary for the study. Thank you.